Story 1. When I was 31, I knew something was wrong. The depression hit suddenly, the fatigue was overwhelming, the weight kept falling, and the pain was constant. Deep down, I knew it was cancer, but no one listened at first. It took 8 doctors and 9 long, terrifying months before I was finally diagnosed with aggressive stage 3 colon cancer. By then, it had almost cost me my life. Because it took so long to find, I spent the next 4 years in a brutal fight just to stay alive. Story 2. Someone close to me did not get her period for a year and was too embarrassed to say anything. She had a brain tumor. Story 3. I ignored the fact that at one time I could not get up without heart palpitations and was fatigued. I later found out my hemoglobin levels were critical, and I had to receive 3 blood transfusions and 2 iron infusions. Story 4. My dad had a stomach ache for a few months. I kept urging him to go to the doctor, but he did not. It was a basal cell cancer metastasis. Rest in peace, Dad. We miss you. Story 5. My dad felt generally run down for a few months and had a toothache. It did not even occur to him to go to the doctor for a cold because he is very fit and had never been sick. Turns out he had squamous cell carcinoma in his throat. He never smoked and drank only moderately. He is 7 years cancer-free. Story 6. I am a 34-year-old male who had back pain that I ignored and managed for months with painkillers. When I went to the doctor, they said I had stage 4 lung cancer, barely symptomatic, that had spread to my bones, brain, and liver. Now I am in palliative care. Do your checkups, everyone, even for the smallest nuisances. Story 7. Constipation and hemorrhoids are not topics most people discuss often. It turned out that the condition was neither hemorrhoids nor constipation. It was colon cancer. Story 8. Pain and numbness in the shoulders. Was told I was sleeping wrong and ended up totally paralyzed a week later with Guillain-Barré syndrome. Story 9. Burning in my feet at the end of the day. I did not ignore it. I brought it up to several doctors and they said it was probably perimenopausal neuropathies. I would cry at night and beg my husband to rub or squeeze my feet because it helped with the nerve pain. Turns out my vitamin B12 level was in the single digits, which should be over 300. I now have permanent neuropathies that could not be reversed. I also have brain fog, insomnia that did improve with supplements, decreased sensitivity in my hands, hand tremors when I get tired, and increased clumsiness because of weakness in my legs. I learned to say, okay, it may be that, but we need to rule out other causes before we assume it is something that cannot be corrected. Story 10. Changes in fingertips, especially bulges. Clubbing of fingers is related to heart disease, lung disease, and cystic fibrosis. Story 11. Melanoma. Mine did not look like any pictures I had ever seen of melanoma. It looked like a tiny earlobe growing on the side of my face. I had planned a trip out of town and wanted it removed beforehand. It looked weird and I did not want to bother covering it up with band-aids, so I asked my dermatologist to remove it. He did, and he sent it off for a biopsy which came back borderline 3rd-stage melanoma. After a scary intubated general anesthesia operation by a plastic surgeon and a night spent in the hospital, all I can say is please have your skin checked regardless of how something looks. Use sunscreen. After the operation, my pathology report came back clean, but I am being monitored every 4 months for 2 years. Story 12. I do not remember it because I do not think it was mentioned to me as I was very young at the time. However, my mother told me that my father occasionally mentioned he thought his heart might be beating irregularly. Not much was made of it then, but years later he developed major problems with heart arrhythmia and eventually died because of it. Story 13. Hallucinations and false beliefs are common symptoms of bipolar disorder, especially when it is undiagnosed. I ignored this for about 5 years. It is a gradual condition that sneaks up on you, though you also kind of know it is happening. I got better eventually. Story 14. Not me, but my sister was always sick growing up with upset stomachs and food making her ill. She had a round face and couldn't lose weight. Our parents never believed something might actually be wrong. She was finally diagnosed with celiac disease after college. Having a gluten allergy or being gluten sensitive is much more commonly discussed today. But there is a huge difference if you actually have celiac disease. It is an autoimmune disorder that, if untreated, can affect the liver and spleen. It can cause osteoporosis, anemia, damage to the nervous system, and increase risk factors for infertility and pregnancy loss. It affects many systems long-term. If you think you might have it, get tested. The diagnosis was totally life-changing for her. Story 15. Great uncle trod on a nail, which went straight into his big toe. He ignored it and ended up with gangrene. He had one leg amputated, but then the infection spread to his other leg. Thankfully, he died before the operation to remove his other leg. He had been a prisoner of war on the Burma Railway, survived that ordeal, and died because of a simple nail injury. Story 16. My dad had chest pain for months. He kept saying it was nothing and would go to the doctor when he had holidays. The doctor said it was nothing and to come back in a few weeks. He went to a different doctor a few weeks later. They said nothing was wrong and to return in a few weeks. He went to the physiotherapist the next week, who immediately told him to see a specialist because there was definitely something wrong near his liver region. He was diagnosed with stage 4 bile duct cancer and died roughly 2 months later. Story 17. My brother-in-law had an enlarged abdomen, fatigue, and a strange ashen pallor. He was a hippie who rarely visited doctors. He thought he was simply getting older. Eventually, he saw a doctor and was diagnosed with hepatitis, which he had likely had for decades. He waited so long that there was little that could be done. We flew out to be with him on a Wednesday, and he passed away the following Tuesday. Story 18. Not a disease, but a disorder. I wish my parents had never ignored the signs of me having obsessive-compulsive disorder when I was younger. I could have received better mental health treatment back then. Story 19. I went to the university doctor because the Phil Mickelson humor commercials for psoriatic arthritis resonated with me. I told the doctor all my symptoms, including the very odd loss of sensation in my toes. The doctor said I was too young for arthritis and then flippantly said, "The toes make me think about multiple sclerosis, but it is probably nerve damage from wearing shoes that are too small." Oh, okay. That is what I shouldn't have ignored. Flash forward 6 more years, and yes, I do have psoriatic arthritis and showed the classic symptoms of it from age 12. I was 31. I never said anything again about my toes. I was put on Humira. Humira is contraindicated with multiple sclerosis. Can result in more lesions. In 2019, I started to have all kinds of numbness after I fell down on ice. The fall caused an arthritis flare-up from the injuries. My very sharp general practitioner took my numbness very seriously, did a mini neurological exam during the appointment, and sent me for an MRI. And guess what? It is multiple sclerosis. My shoes were never too tight. Story 20. I had a friend who thought her weight, skin, sleep, and mood issues were just her personal failings or depression, but it turned out to mostly be thyroid dysfunction. She suffered for many years without knowing that. I don't know anyone personally, but I have heard similar things related to long coronavirus disease. Story 21. When you have a wound that leaks orange fluid, it has passed the infection stage. You are at a critical stage. Please do not ignore simple wounds. I miss my beautiful leg. Story 22. My dad ignored a persistent and inexplicable cough for months. Turned out to be leukemia. I had a friend who started forgetting words and getting headaches. I did not think much of it at first, but then it got worse. She went to the doctor and it was glioblastoma. She passed away within the year. Story 23. Back pain. I had intermittent pain in the middle of my back that did not stop for a week. At one point, I was barely able to move, and I almost did not make it to the hospital, which was an hour away by train, subway, and walking. I went all the way there only to find out I had sepsis, which shortly after developed into septic shock. I literally almost died. The root of the problem was a urinary tract infection without symptoms other than kidney pain. I had no idea what kidney pain felt like before that. I was told that urosepsis is very rare in young people, and I am in my 20s. Also, the triage person wanted me to go to another hospital, but I stayed because the pain was so bad. Story 24. Unusually high fatigue. We were extremely busy and attributed it to that. No other symptoms. Suddenly, a heart attack occurred. Story 25. We did not ignore it. The doctors did. I kept telling them my father's diarrhea would not go away. They said it was nothing. We finally took him to the emergency room, but it was too late. He died from Clostridioides difficile infection. He was a difficult person, but that should not have happened. Story 26. My husband had an addiction to whipped nitrous oxide canisters. When I say addiction, I mean it was constant and the spent canisters were everywhere. He already had some physical and mental health issues, and I think he was using them for pain management. No matter how much I begged him to get help, he refused. He started having delusional thoughts and signs of mini-strokes but wouldn't quit and said they were harmless. He died of a heart attack at 56. Now scientists say there is evidence that long-term use has serious side effects, including risk of heart attack. Story 27. Started going to the bathroom less frequently. Instead of having a bowel movement every day, it was about twice a week. I would urinate once a day, and the urine was always dark yellow despite drinking a lot of water throughout the day. My appetite decreased significantly, and I couldn't even finish a meal because, as I later learned, I had 2 liters of fluid in my abdomen. I waited until I became jaundiced to see a doctor and found out that I had developed cirrhosis at 36 years old. Now I need a liver transplant. Story 28. My wife was anxious and eccentric. Sometimes she would speak poetically. Then she became interested in witchcraft, crystals, astrology, and created an altar to a Greek goddess. I tried to be understanding and accepting. One day, she accused me of performing black magic on her. A week later, she descended into full-blown psychosis. I have not heard from her in over a year. I did not know I could feel this sad. Story 29. My aunt ignored leg sores for more than 10 years and probably other symptoms too because she had a terrible phobia of doctors and hospitals. Her leg worsened to the point where it had to be amputated. Her health deteriorated afterward. She died a few years later, likely from melanoma, but we are not certain. She was vital and active before all this. A retired teacher who loved to travel, but her fear of doctors and checkups ultimately affected her. My family now prioritizes preventative screening. If a doctor recommends a test, we get it, and we are grateful for good insurance. Story 30. We thought my uncle was just getting clumsy and even made fun of it. When his speech started to be affected, my aunt still didn't think anything was wrong, but I was very concerned. They tested him for countless conditions. It turned out he had amyotrophic lateral sclerosis. He died within a year. Of course, there was nothing that could have been done, but I think they could have found out earlier. I also didn't know amyotrophic lateral sclerosis is diagnosed by eliminating all other possibilities. It can take a long time, apparently. Story 31. My mom complained of numbness in her face. Then she became very emotionless and monotone. We found out after she had a stroke that she had stage 4 glioblastoma, which is terminal brain cancer. This was a year ago, and it is a miracle that she is still with us. Story 32. Small purple and red birthmarks appearing suddenly. Not overnight or instantly, but enough that we liked seeing them on my mother's fair skin. The kids all thought they made her look fancy. Diagnosed with stage 4 colon cancer and died 7 months later. Don't ignore any unusual symptoms. Get your annual physical and don't be afraid of colonoscopies. Stay safe. Story 33. My sister was recently diagnosed with stage 4 ovarian cancer. It has already spread into her abdominal cavity. The main symptom she had, in hindsight, was heartburn. It had never really been a chronic issue for her, and she realized she had experienced quite a bit of it in the last year or so. Story 34. My best friend's sister felt really bad and had back pain for about a week and a half. She finally called an ambulance, and when they arrived, she collapsed and died in front of them. Turned out she had sepsis. They were not able to save her. She did not go to the doctor sooner because she did not want to wait in the waiting room for a long time. She was only 23 and left behind her 12-month-old baby girl. It was horrible. Story 35. I wish my stepdad hadn't ignored the tiny cut inside his mouth that wouldn't heal. It turned out to be oral cancer. He passed away within 10 months of his diagnosis. It broke my heart because he was a good man. COVID-19 and all the restrictions played a significant role as well. He might have survived if we had not been in a pandemic. The way he deteriorated was like a nightmare. I would not wish that on my worst enemy. Story 36. Suddenly, at the age of 11 or 12, anytime I did excessive exercise or sports, I would break out in hives and go into anaphylactic shock. The doctors assumed it was just my asthma and prescribed me an epinephrine autoinjector. Slowly, it progressed from any exercise to big bursts of anxiety that caused breakouts, exposed skin, which led to me always wearing pants and long sleeves, small scratches or different feeling fabrics, extreme changes in temperature, sweating, strong perfumes, or excessive breathing. My mother never got it checked out. It went almost 6 years without a diagnosis or examination. When I moved in with my godmother, we finally consulted a dermatologist. They were puzzled and to this day don't really know what it is. I was prescribed anxiety medicine that helped somewhat. They assumed it might be dermatographia or severe asthma. I still do not know the cause. Story 37. My mother became increasingly cruel in gradual increments, and only in private, so teenage me believed I was the problem. She had cancer that had already spread to her brain. Story 38. Leg pain took my 35-year-old sister's life due to a massive embolism caused by deep vein thrombosis. Tomorrow marks 5 months since. She took a piece of me with her. Story 39. My dad died when I was 11 years old. I am 33 now. He went blind and had both his legs amputated due to diabetes. He was also an alcoholic, which did not help his condition. He died at 44 years old. I wish he had taken steps to help himself improve, but even after everything, he kept drinking. Story 40. Not as extreme as others, but after the first time I had coronavirus disease, I experienced severe bouts of presyncope nearly every day. I could not stretch, move suddenly, stand up, or lift things without nearly passing out each time. My heart would pound in my chest as if I had just run a marathon. I would be gasping for air, my vision would darken, my ears would ring loudly, and I would lose function in my limbs, becoming like a rag doll for anywhere from 30 seconds to 5 minutes, but I remained conscious. It turns out that after having coronavirus disease, I developed postural orthostatic tachycardia syndrome. Coronavirus disease caused my blood vessels to weaken, causing blood to pool in my feet. I also cannot stay hydrated with water alone and must have electrolytes much more often than the average person. This condition has landed me in the emergency room more times than I can count. Story 41. My dad ignored heartburn and ulcer-like symptoms for months and had never had a colonoscopy until he was almost 60. He was also in the medical field. When he finally decided he should be checked, the scans showed colon and pancreatic cancer. He survived for about another year after that, but suffered more than I would ever wish on anyone. Story 42. Dad started losing the ability to lift his left arm. He attributed it to being a truck driver and old sports injuries. It turned out to be amyotrophic lateral sclerosis. Story 43. My dad started having a persistent cough before his cancer was detected on a routine scan. He always had a cough and allergies, so we did not recognize the significance until later. His cancer is fairly treatable before it spreads, but it was not found until it had metastasized. It was very aggressive. I cannot help but wonder if he would be alive if we had noticed it sooner. Story 44. I had fainting spells when I was a teenager. The doctor said it was growing pains. When I moved to Toronto at 19, I saw a specialist and was diagnosed with epilepsy. The fainting was me having a seizure and losing consciousness. Story 45. My legs started collapsing. Pain like you would not believe. I could not sit or walk without a walker. I became bedridden. I went to many doctors. I had deep infiltrating endometriosis. My organs were all stuck together, and my sigmoid colon was adhered to my hip internally, pressing on nerves, causing my leg to collapse. I had been on the birth control pill for 20 years straight without a period. I had painful periods, but no one ever diagnosed it. It was growing all those years. By the time it was diagnosed, I had much more pain in the pelvic and digestive areas. The leg pain was first, and I thought I was never going to walk again. Took 2 years. Story 46. A good friend's wife had a really painful and sore leg out of nowhere for a day or two. She said she would go to the hospital the following day and see if a night's rest would make it go away. It was a deep vein thrombosis that became an embolism and killed her. Story 47. Chronic cough. I wrote it off as smoker's cough but found out this past Thursday that I have stage 2 chronic obstructive pulmonary disease. Story 48. My mother-in-law found a lump in her breast and was too scared to have it checked. Later, my father-in-law felt it and insisted she get it examined. She died of breast cancer and left behind a 9-year-old and a 14-year-old. This is still not okay with me. Story 49. I wish my father had not thought that all doctors were quacks and had his prostate checked as often as he should have. He died from prostate cancer last year. Story 50. I'll be honest. My grandmother had a very bad cough for 3 weeks. She was only 65. Lung disease was diagnosed as bad but treatable. Until the antibiotics didn't do anything. You know what shouldn't be forgotten? Your gut instinct. She kept saying it was more than that. It was. She died 4 weeks later. The cancer had spread everywhere. Story 51. My father had left shoulder pain for 3 days. He thought he strained or tore something and had a doctor's appointment scheduled for the following week. Unfortunately, you know how the story ends. Story 52. My mom's dearest best friend of 30 years felt ill for a long time but did not go to the doctor because she had no insurance. By the time she finally went, her vitals were so poor that her doctor called emergency services. She was diagnosed with leukemia and passed away within the year. I miss you, Debbie. Story 53. For many years, my father had gastrointestinal issues such as nausea, indigestion, acid reflux, burping, and weight loss. He underwent a colonoscopy, which showed no abnormalities. He had other gastrointestinal tests, all of which were normal. Then one day he coughed up blood and went to the emergency room. A mass was found in his lung, diagnosed as adenocarcinoma, already at stage 4 and spread to the bones and brain. We were shocked because he had no lung or breathing symptoms until it reached stage 4. Essentially, if you experience unusual symptoms that appear suddenly, especially unexplained weight loss and night sweats, do not stop seeking answers. His cancer might have been treatable if it had been discovered earlier. Story 54. Could not drive 30 minutes without having to stop and use the restroom. I figured something was wrong with my diet. It ended up being multiple sclerosis plaques. Story 55. My husband had a terrible cough and felt congested for a few days. Each day was worse than the last. He started having chest pains as well, but I thought he just had the flu and convinced him that was all it was. He was having a heart attack. The cough and congestion were from fluids building up in his lungs because his heart was not working properly. He had a ST elevation myocardial infarction with a 100% blockage. He survived but has severe damage to his heart and is in heart failure. The doctor told him his life expectancy has been significantly shortened. He is 40 and now has the heart of an 80-year-old man. We have 3 kids, and I don't know what I'll do if I lose him. Listen to your body. If something seems off or wrong, go to the doctor. Story 56. My partner had a lump on his tongue that did not go away. He waited too long to see a doctor about it, and it turned out to be a very aggressive form of cancer. As a result, he had to have his entire tongue removed. 1 year later, our lives are very different now. Story 57. Back pain felt like my kidney was hurting but ended up being pneumonia. Then I had never-ending extreme thirst, fevers over 103 degrees that would drop to 96 or 97 degrees, dizziness, confusion, nausea, difficulty breathing, inability to move, and couldn't keep anything down except water. I was always tired. I thought my body was just taking a long time to beat pneumonia, but I was becoming septic. It almost killed me. I underwent painful procedures and surgery but ended up fine in the end. It's interesting because something in my mind kept telling me to look up sepsis symptoms. I did but convinced myself the symptoms were common with other conditions. Still, I couldn't shake the thought. Prior to this, I barely knew what sepsis was. I just knew it could be fatal. People say your body knows, and it's true. I can't explain why I kept thinking about sepsis symptoms and paying attention, but my body knew. I would also get fatigued and out of breath easily. Walking upstairs left me breathless, and I've never been overweight. I got dizzy very easily and generally always felt weak. It turned out I was very low in iron and had been that way for at least 14 years. I literally started laughing when the doctor told me, and he looked at me strangely. I only found out because of the sepsis. I received iron infusions a few times and now I feel alive. I don't know how to explain it, but I just feel healthier and renewed. Story 58. Almost 3 years ago, my husband was experiencing night sweats, lost a considerable amount of weight. He is a big guy, so it was not very noticeable, and had some petechiae which looked like small reddish spots. Blood tests showed his white blood cell count was extremely high. He was diagnosed with chronic myeloid leukemia. Fortunately, it is treatable with medication, and so far he is doing well. I had no idea he had it, except I made him see a doctor because he was 42 and had insurance. I did not know about the night sweats. A friend of mine had been diagnosed with the same condition a couple of years earlier and had no idea until they had blood work done after being hospitalized with COVID-19. Story 59. Weight loss without any effort or taking weight loss medications ended with stage 3 breast cancer that spread to my lymph nodes. I lost 60 pounds, and the doctor just said, "Good, you're losing weight." Story 60. Feeling faint, dizzy, fatigued, and nauseous. It was not anxiety. It was arrhythmia and mast cell activation syndrome. Story 61. Adrenal cancer. We attributed the sudden weight gain in our teenage daughter to hormones. In hindsight, it was classic overproduction of cortisol. Irregular periods, hair loss, hair on her face, then the hump. Only a few ever beat that. Story 62. Sore throat caused by squamous cell carcinoma. She was scared to go to the doctor for weeks. When she was finally diagnosed, she passed away 3 months later from the treatment. Story 63. My brother drunkenly told me that he had blood in his stool. I laughed and said it was probably just hemorrhoids, but suggested he see a doctor. He died of colon cancer a year later. Story 64. My mom showed symptom after symptom but was just a stressed and anxious mom. My whole childhood, I had a mom who, for lack of a better word, was bedbound. 15 years later, she was diagnosed with scleroderma, which was progressive. Adding to the difficulty, the doctor refused a biopsy of a spot on her leg 3 times. Once the biopsy was done, the doctor had a nurse inform her of skin cancer this week. Story 65. Blood in stool. I was told for years to lose weight because my bloody stools were from hemorrhoids. In December 2024, I began trying to get a referral to a gastroenterologist. Finally, last month I was able to have a colonoscopy. I was diagnosed with rectal cancer after the procedure. I am a 41-year-old female. Please, if you think something is wrong with your body, seek help. Follow up, and if you are not satisfied with your care, look for a new doctor. Story 66. Smoker's cough. It was not bad when we met 5 years ago. It became very bad towards the end of his life. Story 67. Nosebleeds while I was sleeping and night sweats. I was severely anemic, and when I was diagnosed, they told me that a few weeks later, I would have died from cardiac arrest. It was Crohn's disease. Story 68. Blood in urine or stool. If you have blood coming out of your body when it should not, see a doctor. Could be colon cancer, as in the case of my family member, or bladder cancer, as in my case. Make sure they take it seriously. Story 69. I wish my doctor had stressed the severity of what he thought my liver was doing, but he just said it looked okay. Note, it was not okay, and I now have cirrhosis caused by non-alcoholic steatohepatitis. Story 70. My child has diabetes. I thought all of the symptoms he was experiencing before going into a coma were related to hormones. Story 71. Stomach pain was initially thought to be food poisoning but turned out to be liver disease. There was a pre-existing condition, but the connection to stomach pain was not known at the time. Story 72. My great-aunt is currently trying to ignore multiple seizures. We still do not know what is wrong with her, but she wants to leave the hospital. Story 73. Bleeding from the rectum. He did not want to talk to the doctor about it. It turned out to be advanced neuroendocrine colon cancer. He has less than 1 year to live. The cancer is inoperable, and he has been undergoing chemotherapy for a year already. Story 74. My granddad not controlling his diabetes led to end-stage kidney failure. I remember him telling me he wished he had listened when the doctor told him to watch his kidney function because it was low. He passed in October 2024. I miss him dearly. My grandparents were married for 60 years. My granddad passed first. It was strange because before he passed, he had a cough. It wasn't COVID-19, just a cough. My grandma passed on April 12th of this year. She had health issues but passed unexpectedly. She also had a cough before she passed, and she was not sick. I always thought it was odd, and I wish I knew what it was. Story 75. My dad was a functional alcoholic and had prior health issues from his drinking and smoking years before. One day at a family party, he was throwing up, which was unusual for him. By the end of that week, he went into cardiac arrest and passed away. I had been living in a different state for a few years at that point and did not get to spend much time with him before his death. Story 76. A relative could not lift her right arm and had to manually lift it with her other hand. This was the first in a series of strokes over the next couple of weeks that led to a major stroke, which was when the issue with her arm was discovered. Story 77. The tiniest bit of blood with bowel movements is not always consistent and may happen rarely. If you notice even the slightest amount of blood, even just once, get a colonoscopy as soon as possible. Refuse other tests and insist on a colonoscopy. Most likely it is hemorrhoids, but the only way to know for certain is through a colonoscopy. Do not ignore it, as it could lead to a colorectal cancer diagnosis at a young age. Story 78. Sudden onset diabetes that does not respond to medication can be a sign of pancreatic cancer. Pancreatic cancer is rarely diagnosed until it's stage 4 because this symptom is often missed. Story 79. Dad died a couple of years ago from a pulmonary embolism. He was undergoing preventative chemotherapy for stage 3 colon cancer after the doctors removed a third of his colon. After a couple of rounds of chemotherapy, he started complaining of chest pains on his right side, where his port was located. The chemotherapy team did not mention it to his doctor and simply told him, "It happens sometimes." We tried to get him to go to the emergency room, but he refused, saying he would tell his doctor at his checkup the next day. The last thing he and I talked about was how everyone else undergoing chemotherapy was much sicker than he was and how he felt bad complaining about his chest pains. He died that night after severe stomach issues and fainting a couple of times. At least 2 of the women he did chemotherapy with are in remission now after battling leukemia. Life is funny like that sometimes. Story 80. Nosebleeds, prolonged wound healing, extreme fatigue, easy bruising, and chronic bruising. I have cirrhosis and I am currently waiting for a liver transplant. Story 81. My husband had sores on his legs. He would itch his leg just a little bit and blood would run down from the spot. It was leukemia. He passed away 10 months after the diagnosis. I miss him dearly and wish I had known something was wrong. Story 82. I had stomach burns but thought it was because I was eating too spicy. It was not that, but it did not help. These were the first signs of the chronic illness I ended up having. Story 83. This thread makes me realize that I am going to die alone from something unexpected. No family, no partner. If something serious happens, like an aneurysm, my dog will be the only one to see it. Story 84. I hate reading threads like this because many of them are about things I have ignored and nothing happened. Do I need to be more worried than I am? Story 85. Unexplained weight loss and sudden decrease of appetite. My mother passed away from stomach cancer a few years later. Story 86. I had a coworker who started to itch excessively. She had cancer and eventually succumbed to the disease. Story 87. Consistently waking up with a headache. According to my mother's neurologist, a good night's sleep is supposed to reset your headache. Your brain rests and recovers while you sleep. If that does not happen, there is something going on that prevents your brain from healing on its own. Story 88. My mom experienced bloating and gas. She thought she was eating too much fat, but it turned out to be stage 3B fallopian tube cancer with a tumor the size of a softball. Story 89. Breast lump. I was told there was nothing there and was made to feel silly. I was 36. 1 year later, breast cancer with metastases to the brain. Story 90. Towards the end of 2022 and the beginning of 2023, my father, aged 66 at the time, noticed something was wrong with his digestive system. Over the next 6 months, he visited his family doctor several times to determine the problem and was repeatedly told it was simply constipation, common at his age, and advised to continue taking the over-the-counter laxative initially recommended by the doctor. My father persisted because he felt something else was wrong. After 6 months, the family doctor admitted, "I give up. I can't figure out what is going on with you, so I'm referring you to an internal medicine specialist." Within 1 to 2 weeks of his first appointment with the internist, he was diagnosed with stage 4 pancreatic cancer and a pulmonary embolism. He received the diagnosis in June 2023 and stayed with us until April 2024. The saddest part is that my father always knew and reminded anyone who would listen that you must advocate for your own health. In this case, he was advocating for himself. Unfortunately, the dismissiveness of his family doctor resulted in a late diagnosis and a fatal outcome. I miss him every day. Story 91. I was too young to remember this, but my father got very sick in his mid-40s. He couldn't stay awake. He was a doctor and would fall asleep during surgeries. He would fall asleep at red lights. Eventually, he was too sick to work anymore. He didn't ignore it, but the doctors had no idea what was wrong and thought he was dying. Eventually, a family friend, a rheumatologist, said, "Have you been tested for Addison's disease?" It turned out he had secondary Addison's disease, which means his pituitary gland didn't send enough hormone to his adrenal glands to produce cortisol, which is necessary to live. I believe primary Addison's disease is more common, which is what John F. Kennedy had, but he kept it secret. A simple twice-daily dose of cortisol cured his ailments, but if he didn't take it as required, he would have an Addisonian crisis. He experienced this when he was in his 70s and recovering from spinal surgery in a rehabilitation facility. He kept telling the nurses what was happening, but they ignored him. He finally called emergency services himself. The emergency room doctor said he wouldn't have survived if he had waited any longer. Story 92. I wish my mother had sought a second opinion from another doctor sooner instead of when she did. She may have had several more months instead of just the 4 weeks she had. Story 93. Headaches that were not her normal migraine type of headache. She had a bleeding aneurysm for approximately 6 months prior to it bursting. Story 94. I had nonstop nosebleeds and petechiae on my legs for 2 weeks, with random bleeding for a few weeks before that. I casually mentioned it to my psychiatrist, who sent me to the walk-in clinic at the local hospital. A few hours later, I was admitted with a platelet count of 0. I started hemorrhaging while waiting for a room. It took 7 months to resolve, finally with a mild form of chemotherapy. They called it immune thrombocytopenic purpura, but my sister has this as well, so I believe it to be genetic. Story 95. Fatigue. My father was getting very tired from small activities like walking up a flight of stairs. One day, he finally agreed to get an ultrasound. It was pancreatic cancer. He died just 1 month later. Story 96. My mom had a really bad headache, which is not unusual for her. She gets migraines fairly often, but this one was really bad and got worse throughout the day. By the time she got home from work, it was bad enough that she called a nearby friend to come over and have dinner because she did not feel well and did not want to be alone. It was probably just a bad migraine or menopause or something like that. It took 10 minutes for her friend to get there, and in that time, she was on the floor, barely conscious and throwing up constantly. When she arrived at the emergency room, her blood pressure was in the 200s, and a blood vessel had burst in her brain, though it was a small one, thankfully. She is okay now, though she has to be careful with her blood pressure medication or it will rise very quickly. What is surprising is that she had just been to the doctor for a physical 2 weeks before, and her blood pressure was fine. The only symptom she had leading up to it was a really nasty headache. Story 97. An intermittent cough lasting 4 months. which did not seem serious, was the only symptom of stage 4 lung cancer. Story 98. Slight decline in mental acuity in my father. He had a stroke on Thursday. Thankfully, he is mostly normal if you do not know him. Story 99. Any fever that is not responding to standard oral antibiotics requires immediate attention. The moment you realize the treatment is ineffective, go to an emergency room and request testing for sepsis. Do not accept refusal. Sepsis can be fatal in as little as 12 hours. I would still have an aunt if the emergency room she visited had tested for sepsis on her first return. Story 100. I wish my doctor had not ignored my recurrent kidney infections. They were not kidney infections at all. Story 101. My brother urinated blood for a year before his metastatic bladder cancer was diagnosed. Denial is difficult. Story 102. I experienced wheezing for years, especially in cold weather or after exercising. I thought I was unfit despite playing sports every other day. I have asthma. Thank God it is only mild. I live in the countryside and do not smoke or vape. Story 103. Constant cough for no reason. My aunt had a chronic cough even after she quit smoking cigarettes, and it would be the middle of summer. She was more tired and had become irritable more easily. One day I noticed she had severe clubbed fingers, and I told her it was a symptom of lung disease or cancer. She told me she had always had clubbed fingers. She did not like that I said that because my grandmother, her mother, passed away from stage 4 non-small cell lung cancer, for which she was her caretaker. She eventually went and got her lungs checked. She also had stage 4 non-small cell lung cancer and passed away within 9 months of diagnosis. She was a great woman and did not expect this to happen to her. Story 104. My feet were swelling a lot. I thought I might have hurt them somehow and wrapped them. It got worse for a couple of weeks. I eventually made it to the emergency room when I could barely walk. I had congestive heart failure and an ejection fraction of 16%. It was during COVID-19 in 2020, so I was trying to avoid being around medical environments, but that was very unwise in retrospect. I spent a month in the hospital. Story 105. Persistent dry cough. Cough medicine did not work. It turned out to be lung cancer. We lost him a year ago in May. Story 106. My friend had mild gastrointestinal problems, including diarrhea and mild pain or discomfort after eating. She thought she was gluten intolerant and lactose tolerant. Later, she believed she had irritable bowel syndrome. She experimented with her diet for about a year. She did not see a doctor because she did not think it was serious. She had bowel cancer. By the time she was diagnosed, it was too late. She was 34 years old with 2 small children. Story 107. Back pain was my father's only symptom for months. It turned out he had stage 4 lung cancer. He died within 3 weeks of his diagnosis. Story 108. My mom developed lumps in her groin. Her primary care physician said humans get lumps in old age like dogs. They do not. It was mantle cell lymphoma. She died 18 months later. I strongly dislike that primary care physician. Story 109. I was fatigued and got nauseous every time I would lie down or get up for about a month. I figured I was stressed from work and tried to manage it with diet, which did not seem to help. I went to a doctor and they thought it might be food poisoning. A few weeks later, I noticed I could not feel temperature in my left hand, like a cold water bottle. Finally, I started noticing slight weakness on my right side, which I attributed to not being able to eat properly due to the nausea. I went to the doctor and fell down due to the weakness. I thought I had tripped, but they sent me for scans in case it was neurological. It turned out to be stage 4 melanoma, which had metastasized to my brain and several other organs. Of all the metastases, all the symptoms could be traced to the one in my brainstem. Story 110. Severe bloating. The roommate was so bloated she had to move her stomach with her hands to use the bathroom. Days later, it was paired with jaundice and swollen limbs, and confirmed to be advanced liver failure. We are waiting until she is comfortable enough to let us know how long she has as they prepare her for end-of-life care. We found out yesterday that it was alcoholism. She hid it well. Story 111. Sharp pain in my shoulder eventually spread to my chest. The pain became so severe that I could not breathe without experiencing the worst pain of my life. I went to urgent care and was sent home. The pain subsided for half a day, but I woke up essentially choking. It turned out to be a pulmonary embolism located very close to my heart. I was only 19 years old, and genetic testing proved that I am prone to blood clots. It was very frightening to be so young and so close to death because of my body's condition. Story 112. I woke up on my birthday 2 years ago in the middle of the night and couldn't see anything out of my left eye. I thought my eye must still be asleep, so I got a drink and went back to bed. I kept opening my eye to check if I could see or not and eventually fell back asleep. The next morning, I could partially see. 6 months before, I had gone to the emergency room because I was seeing strange things in that eye. People on the TV appeared to be melting, and when I looked in the mirror, I didn't see myself. Everything looked wrong. I was panicking, and the emergency room said it was a migraine in my eye. They gave me medication, and after about 6 hours, it was fine. On my birthday, I thought it must be another migraine in my eye, so I waited. After 3 days, my daughter said, "Mom, call an eye doctor." They said it was an emergency and got me in immediately. I had hundreds of old blood clots and a huge blood clot blocking my main artery, which was killing off my eye. The doctor said it had happened before because of the old blood clots. So the first migraine was actually strokes in my eye. This time I had hundreds of strokes in that eye, and since I waited, I can't get the vision back. It's like looking through a windshield covered in heavy rain. I cannot see anything right below me, like toys on the floor, and I tripped over a pillow the other day, breaking my knuckle. It is very frustrating not knowing where I am stepping. The ophthalmologist said he never sees this in anyone under 80 years old. I had injections in my eye for 6 months, and they want to do surgery, but I don't see the point if I can't get any vision back. This is not the first time doctors have overlooked something important. Do not go to the emergency room for strange eye symptoms. Go straight to an eye doctor. Story 113. My husband's grandmother developed a cough over the Christmas period that did not go away. She had the cough for months before finally visiting the doctor. Her husband only enabled his wife, saying it was just part of aging and that it was a waste of time to go. She was diagnosed with lung cancer, and because it had been left untreated for so long, it was too late. If she had gone to the doctor earlier, it would have been treatable. On the day she died, her husband insisted on getting his morning newspaper as he did every day. He said we all needed to get on with life. Since her death, he constantly says he is just waiting to die to join her. 7 years later, her clothes are still hanging in their wardrobe, and he talks to her ashes as though she is still living. For someone obsessed with telling people to move on, he certainly has not. Not that I blame him, but the way he has handled his grief is toxic and isolating. Story 114. Dementia. I saw it happening in my grandmother and did not know there are medications that can slow some forms of dementia. Story 115. I have had chronic diarrhea for about 2 years. I also have not seen a doctor in about 2 years. I am a 38-year-old reasonably healthy man. I had a colonoscopy about 7 years ago because of increased diarrhea, and it showed nothing. I hope I am not dying. Story 116. Constant bleeding years after menopause. Was told it was fibroids. Mother died a few years later from uterine cancer. Story 117. My dad went on a fishing trip to his sister's house 3 years ago. One day while he was there, he spent a few hours vomiting randomly. He thought he had food poisoning because he had eaten something different than usual, and he was fine for the rest of the day and into the next when he got home. The following day, he had a massive heart attack during his morning walk and died before he could be transported to the hospital. The vomiting was probably a sign that he had already suffered a heart attack and his heart was so blocked that he could not survive without prompt care. None of us could have guessed. Story 118. Not a severe disease per se, but I had bad stomach pains. I convinced myself and my doctor that it was just a stomach ulcer, as I had one before. I went through a round of medications and did not get better, so I decided to ignore it for months. I ended up in the emergency room with severe stomach pain and was told I needed emergency surgery to have my gallbladder removed. I am very thankful it was not worse, but that experience taught me to stop thinking I know better and that it will just go away. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.